Hey James,
Hey,
welcome back to the office.
thank you.
How is it going?
It's going well.
Perfect. So today I have you scheduled for a head and scalp examination. Is that correct?
Yes, it is.
Okay, so it looks like you've been experiencing some headaches in the last couple of weeks.
Yes, I have.
So we're just kind of testing to rule out any obvious abnormalities today. Make sure that nothing more serious is going on.
Okay, good.
Perfect. So let me go ahead and jump right in. I want to figure out what's going on to see if we can get you feeling any better. So I'm going to put a pair of gloves on to begin with the examination. So can you tell me a little bit about what you've been feeling? I saw that there was some kind of tingling and tightness around the temple area.
Yeah, definitely tingling and tightness on the temple. Kind of like the middle of my forehead going out to the sides, like a dull, throbbing pain.
Got it. Okay. Any pain or tenderness in the head or scalp itself?
Not necessarily, no.
Okay. How about in the jaw area?
I don't think so.
Okay. And as always, I just want to get your informed consent today. I will be touching your face and performing various examinations on you. Is that okay?
Yes, it's okay.
And you have my consent to ask any questions if need be. So let's go ahead and get started with a visual inspection. So I have Penlight, and you might want to keep your eyes closed for this just so it's not shining right in your eyes to start with. So just using this to visualize the skin, looking for any more obvious abnormalities that could be present externally. Shining my light over the bridge of the nose, looking for any signs of asymmetry in the face. So far, not seeing anything. Then look at the ears. Okay. And then, of course, having a look at the hair. And I will be visualizing the scalp. Looks like your hair has gotten quite a bit longer since our last visit.
Yes.
Let's go ahead and have a look inside your eyes. Can you open your eyes for me? I'm just going to shine my pen light in your eyes. Okay. Just looking at the pupillary reaction. Look up towards me. Perfect. Just like that. Okay, just relax, just having a look at your lips, as well as your nose. Okay, I'm going to have a look at your scalp, and before I visualize any deeper, I'm going to perform a couple palpations along your scalp. Please tell me if any of this is painful. Specifically around the temple area, do you feel any pain, discomfort, pressure, numbness, tingling in this area?
No, I don't.
Okay. If I palpate deeper, then there's no pain here. And just checking for any lumps or bumps along the scalp. You've not hit your head recently, correct?
No,
Also palpating behind the ears. Good. Any pain or pressure here?
a little bit of pressure, but no
A
pain.
little bit of pressure. And here?
Same.
Here?
Same.
Here?
Same.
And here?
Same, yeah.
But no pain, just pressure. And how about any pain or pressure here?
No.
And if we go all along, no pain or pressure here. Moving down to the mandibular joint here, any pain or pressure with any of this motion?
A little pressure.
A little pressure, but no pain.
Right.
Okay. If I move down, pain or pressure here?
Not as much.
Less. Okay. In here?
No.
In here?
No.
So less here compared to here.
Yes.
Okay. So look at the scalp. I'm actually going to take this small comb that I have here to separate a small area just so that I can better visualize the skin. Skin color and texture appears normal. Do not see any signs of dandruff or seborrheic dermatitis. There is no visible flaking or discoloration. Scalp color is normal and consistent with skin color, so there's no signs of redness or any abnormal darkening of the skin. Hair follicles appear to be intact. And hair itself appears very healthy. I'm going to tug slightly. Any pain here?
No.
Do you feel any pressure relief as I tug?
No.
But it's not uncomfortable.
No, it's not.
Have you been keeping up with a regular hygiene regimen as far as washing your hair a couple times a week?
Yes.
No changes in your routine as far as that goes. Any new products that you've been using recently? Any new hair products, hygiene products, laundry soap?
I have a new body wash.
New body wash, but you don't ever use it on your face, correct?
No, I don't.
Okay. Now, is there any one side that's more painful or uncomfortable versus the other? Are you getting these headaches kind of in an isolated area, more so on the left or the right, or is it just kind of equal bilaterally?
It's hard to say. For the most part, it's equal, but some days it's just over one of my eyes.
Okay, so I am just now seeing some tearing in this eye. Have you been experiencing excess tearing?
Yes, I have.
In both eyes or just the one?
Just this one.
I'm going to palpate around the orbital socket. This might be slightly uncomfortable. It shouldn't cause you any pain. It might increase the tear production. Essentially, I'm just feeling around for any buildup of your sinuses. Sometimes inflammation in the sinus cavity or even a blocked tear duct can add pressure to the area, which could be causing the headaches, as well as the excess tearing. Any discomfort as I palpate around this area?
I don't think so, no.
And you're able to feel all of this?
Yes.
Just as well as you feel it on the side. And same here, no pain or discomfort.
No, not at all.
So just feeling around your jaw here. Have you open? Good, and close. And again, open and close. Can you move your jaw side to side for me? Good. Not hearing any clicking or popping. Do you grind your teeth at all? Is that something new that you've started?
No,
Still no grinding. Okay. This probably isn't related to any TMD or temporal mandibular joint disease. Okay. Just gonna feel around your clavicle, feeling for your lymph nodes, looking for any inflammation in your glands, any abnormalities that might indicate an infection. So generally the lymph nodes are not palpable, which is what we would want. If for whatever reason I am able to feel them and they are palpable, we might be looking at some sort of infection that could be leading to inflammation, secondary cause to the headache. So essentially just looking for any reason to believe that the headache is a symptom of a bigger problem. Okay, so I'm going to use my otoscope to have a look inside of your ears. So if I can have you turn your head all the way to the left. Just visualizing the ear canal. Looking for any abnormalities. And the tympanic membrane. Everything appears to be intact. No pain or discomfort here, correct?
Correct.
Perfect. Let's turn all the way over the other way. And same thing. Okay. Tympanic membrane is pearly white. Grayish in color. Opacity is normal. Cerumen levels are within normal limits. And ear canal is totally visible. Perfect. Okay. Very good. So no suspicion that this has anything to do with your ears. I do want to perform a brief hearing test just to rule out any further abnormalities. So keep your eyes closed for me and just say yes if and when you hear a sound, okay?
Yes. 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 Yes.
Good. So now I'm going to make a clicking sound, and again, I want you to just say yes if and when you hear it.
Okay. Yes. 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 Yes.
Now I'm going to make a quieter clicking sound, and I want you to say yes if and when you hear it. Good. Okay. So hearing all appears to be within normal limits. I have a thermometer here that I'm going to use to check for any temperature abnormalities. Could be a further indication of any signs of infection. So I'm going to check in various different places along the face. This will just help me look for any isolated signs of infection if there's a large variance in temperature. Okay, so on the temple area is warmer. Which does indicate some mild inflammation. 99.1, okay. Okay, so there is some mild variation here. I'm getting 99.0. So definitely some slight inflammation here in this area. I'm going to check the scalp as well. So the right side is overall a couple degrees warmer than the left, and you did say that you were feeling some of these symptoms, especially in your eye, more so on this side. So just pardon me when I check directly over your eyelid. Okay. Well, some very slight temperature variations there. I would like to move on to a different portion of the examination, and I'm going to test for first any abnormalities in your tympanic membrane. So does this cause you any pain or pressure? I want you to not focus on the noise, focus on the sensation of the air, and let me know if you feel any abnormal burning, pain, pressure, tingling, that kind of thing inside your ear. Does that feel okay?
Feels fine.
No pain?
No, no pain.
And as I increase speed here, no pain.
No pain.
What if I do slow, heavy pushes of air, no pain?
No pain.
Okay. I'll repeat that on the other side. So just tell me any pain or pressure. Does that feel okay?
Feels fine.
And as I speed up here, no pain.
No pain.
And heavy pushes of air, no pain. Good. Okay. Since I have this out, I would like you to open your eyes for me. Just testing your pupillary reactivity. Okay. I would say it's about even. You're about a +1 versus a +2 on this side. Very slight overreaction here. Just indicating some oversensitivity possibly on this side. So I'm just going to use this acupressure tool to place a very concentrated pressure underneath and around your eye. And I'm just looking for essentially the return in blood flow, looking for any abnormalities, see if there's any occlusion. And then of course comparing that to the other side. Okay. Was that more uncomfortable on one side versus the other, or about the same?
About the same.
Okay. Any pain or pressure as I push on your tear duct here?
Slight pressure.
Slight pressure. In here?
No. No.
Okay, so just on the inside. And as I go down your sinuses here, does that put any pressure?
Just very slight.
Both sides?
More so the first one.
More so on this side?
Yes.
Can you tell me when that pressure releases? You feel it still all the way here?
There, about there.
Here?
Yeah.
On this side you don't really feel it?
No.
Okay. So about here, you would say.
Yeah.
And does that carry out this way?
Yes, it does.
Okay. Can you tell me at what point here it stops feeling that way?
About there.
Okay. Open your eye for me. I just want to see where in line we are. So about here you said?
Yes.
Okay. Midline to the pupil. And do you feel that same sensation at the top?
No, I don't.
No, it's only at the bottom.
Yeah.
And does it radiate down your face at all?
No, it doesn't.
No. How about up towards your eye?
No, it doesn't.
No. Okay, so just kind of laterally here.
That's correct.
On this side. Okay. Okay, you can close your eye for me. Just gonna visualize with my pen light, and I don't want to blind you, so just applying that same pressure. Looking for any abnormal signs of reactivity in this area. Okay. So if this feels like a 3 out of 3 pressure, what would you say this feels like?
0.
Okay. So definitely some pretty significant pressure buildup in this area. Can you tell me if you can feel this?
Yes, I can.
Is that uncomfortable at all?
Yes,
And can you feel this here?
yes.
Is that uncomfortable at all?
No.
And does this feel any different than this?
No, it doesn't.
Any pressure sensations as I go around the orbital socket here?
No.
Okay. As well as on this side? All of that feels the same?
Yes, it does.
Okay. As well as on your scalp? Feels the same?
Yes.
Any difference as I go here to here?
It's just a little less sensitive because of my hair.
Perfect. If we separate this area, that should now feel the same?
Yes, it does.
Any difference here versus here?
It feels more tingly the first time.
More tingly here.
Yes.
So you feel not less, you just feel a tingly sensation.
Yes.
And here, does that feel tingly at all?
No, it doesn't.
Tell me at what point it starts to tingle.
Up there.
Okay. If we come from this side, okay. You're not feeling that sensation here anywhere.
No.
Does that tingle upon manual palpation or just with the sharp sensation?
Just with the sharp sensation.
Okay, and how about with this sensation? No tingling there. And no tingling as we go around,
No.
as well as here.
No.
Can you feel that this is soft?
Yes, I
Can
can.
you feel that here as well?
Yes.
And here as well?
Yes.
Okay.
Yes.
Feel that everywhere feels the same?
Yes, it does.
Okay. Can you feel that?
Now I can. Yes. 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 Yes.
Very good. Any difference in sensation here versus here?
About the same.
About the same. So same sensitivity levels here and here.
Yes.
Okay. Can you tell me what the difference is between this and this?
One's bigger than the other.
Okay, so this one is bigger than this one.
Yeah.
Okay. So if I call this 1 and I call this 2, can you tell the difference?
Slightly, yes.
Okay. So tell me if this is 1 or 2.
I'm not sure. Can I have the 1 and 2 again, please?
So this is 1
Okay.
and this is 2.
Okay.
Okay. So 1 or 2.
1, 2, 2, 1, 1, 1, 2, 2, 2, 2, 2, 2, 2, 2, 2,
Okay. Very good. Do you think I'm seeing some slight edema in this area? Take my stethoscope and have a listen to your face. I know that sounds a little odd, but it will help me listen for any audible occlusions and blood flow. So just if you breathe normally for me, you're going to feel a cold stethoscope on your face, okay? Can I have you make a humming sound for me? Good. One more time. Okay. So no audible occlusions anywhere, which is a good sign. Okay. So the last thing I'm going to do, James, is just perform a couple percussions of your face. So a couple different reflex hammers here that I'm going to use to just tap along your face. Let me know if you feel any pressure here. Okay. So move towards the temple. Any pain or pressure?
No, no pain, no pressure.
So on this side. No pain, no pressure, correct?
No, no pain, no pressure.
Good. And no pain or pressure with any of this. Okay. And just taking a smaller hammer. No pain or pressure here.
No.
And this feels the same all around. Is there any difference in sensation here?
No, there's not.
Okay. And here.
The same.
And your jaw open for me. Good. Go ahead and close. So let's go ahead and test some facial strength. I want to see if there are any abnormalities on either side. So if I can have you puff your cheeks for me. Don't let me push them in. Don't let me push them in. Can you puff just the one side and the other? Now bring your tongue to the side of your mouth and don't let me push it in. Good. On this side. Can you puff your lips? Good. Now close your mouth tight. Don't let me open. And open. Don't let me close. Very good. Close your eyes tight. Don't let me open. And open. Don't let me close. Good. You pull your chin to your chest. And head towards me. And this way. Good. And this way. Good. Okay. So all of your strength and resistance is within normal limits. So the good news is that I don't see anything obvious that could be causing these headaches.
Okay.
The bad news is that I don't see anything obvious that could be causing these headaches. So what I mean by that is there's no way for me to really tell you what exactly could be causing it. Have you been experiencing any increased stress levels recently? Any change in your lifestyle or dietary habits? Any external stressors that maybe could be causing you these headaches, do you think?
No, nothing I can think of.
Nothing, no major changes recently?
No, not at all.
Okay. So what I recommend going forward, James, is that we maybe get an MRI done. So that will give us an internal image of what could be going on in your brain, see if there's any vascular changes, if there's any signs of an embolism or a blood clot. Obviously that would be worst case scenario, but it is best to be careful because I'm not really sure what's causing the headache. I do think that we should go ahead and get that done. So I can schedule you for that.
Okay.
You would have to come back. We'll make you an appointment. You come in, get the MRI done. I would like to do it with contrast, so I will have you fast the day that we schedule it. We can get it done early in the morning. That way you don't have to go the day without eating. And then we'll get the results back from there. If there are no abnormalities with your MRI, then we could potentially do some further testing, like a cranial nerve exam, some neurological assessments, test to see if there's anything else going on. Sometimes it's very simple, like lack of sleep or increased anxiety. Sometimes it could be more serious. So it really just depends. At this point, I'm not, emergently concerned, but I do think the MRI will give us some better answers, okay? Okay. So in the meantime, I would recommend switching between Tylenol and naproxen every 4 to 6 hours, depending on your pain level. Make sure you're not taking them at the same time, but you should be safe to alternate, okay?
Okay.
All right, so if you want to head up to the front desk, Serena can make that appointment for you, and we will see you in for the MRI. I will contact you when those results come back.
All right, thank you.
Perfect. All right, James, thank you so much.
Sure.
Hope you feel better.
Thank you.